होता ये है कि अब समझाने के लिए मैं इसमें दो मूवमेंट्स वी हैव अ फ्लेक्शन and we have an extension. So ये hinge type की movement है, लेकिन it is something different of other than the hinge joint. That is, it also provide a rotation also. एक atypical type of hinge joint है जिसमें थोड़ी बहुत rotation मौजूद है. That is, it has a medial rotation, a lateral rotation, or you can say a gliding type of movement is there. So it's a primarily a hinge type of synovial joint. Condylar joint we कहते हैं, also call it a condylar joint because condyles are involved in these joints. That is, the condyle superiorly by the femur and inferiorly by the tibia. So it allows flexion and extension, and the hinge movements are combined with gliding and rolling with rotation. जैसे मैंने बताया कि gliding और rotation में भी थोड़ी बहुत movements होती हैं. ये जनाब ये flexion extension हो गया, but it also moves like this one. That is, the femur moves over the tibia. So it has somewhat a gliding and rotation movement. So that's why it is one of the atypical type of, not atypical, it's a primary hinge type, condylar type of joint, allowing flexion and extension, plus there is a gliding and rolling movement with a small degree of rotation. The knee joint consists of three articulations. Basically, the knee joint consists of three articulations, तीन articulations हैं. एक articulation तो आप बताएं किस किस के दरमियान होगा, ये स्कैन एनिमेटेड what are different three articulations of the knee joint. कौन-कौन से तीन articulations होते हैं knee joint के अंदर? What are the three articulation? Bony articulation in the knee joint. Make a guess. जो आप समझ सकते हैं कि this could be a okay femur and tibia, good tibia and femur, good. Femur, tibia, fibula, good. Any other? We have femur, tibia, femur and fibula. Okay, good. Patella, of course, yeah, not question. Femur and patella. It's also joint. Femur, tibia, patella. Good. Hamna, you have answered it correctly. So majority of you now understand that the knee joint is basically contains three type of joints. मगर इनमें एक जो है that is more extensive, more participating, more provide more movement. So these are three. Number one is two femorotibial articulation. जो आपने कहा two femorotibial articulation, and that is एक right यानी कि medial और एक lateral. So there are two femorotibial, that is the condyle of the femur have attachment or articulate with the condyle of the tibia. So we have a medial condyle and similarly the lateral condyle of the femur with the lateral condyle of the tibia. So two femorotibial articulation, lateral and the medial, between the lateral and the medial femoral and tibial condyle, and one intermediate femoropatellar, one intermediate the femoropatellar. ये देखिए ये जो है ना ये femoropatellar है. अगर आप देखिए patellar surface of the femur है, इस पे आके patella एक attach करता है the patellar surface of the femur, forming femoropatellar articulation between the patella and the femur. So 1, 2, and 3 basically. एक चौथा भी है, and that is between the fibula and the tibia. That is, I mean, एक और बनता है जो कि fibula, upper end of fibula, and with the lateral condyle of the tibia. लेकिन चूंकि इसके अंदर movement as such नहीं होती, ये जो दूसरे joints में होती हैं. So this is also a joint जो कि upper end of or head of the fibula makes with the lateral condyle of the tibia. ये भी एक joint बनता है. It is also a joint formed between the upper end of fibula, that is head of the fibula, with the lateral condyle of the femur. Tibia. Now, knee joint is relatively weak as we can compare it with the hip joint, which is a very stable joint because you have the head of the femur fitted within the acetabular fossa. It has a ligament, it has the muscles, so that is a strong joint. Knee joint is relatively weak mechanically because the surfaces of the two bones, that is the फीमर, अगर हम फीमर के कंडाल्स देखते हैं और अगर कंडालर सरफेस ऑफ द टिबिया देखते हैं तो टोटली एकदम से आर्टिकुलेट नहीं करते. I mean there is a corrugate, there is a degree of non, I mean they are not completely fitted with each other. There is a wide area where it can easily dislocate or can easily slip. So ideally it is mechanically it's a weak joint because of the incongruence of the articular surfaces of both bones, that is the femur and the tibia. As we compared to, so they compared it that ball stick in a wrapped tabletop. So it is not a mechanically stable joint. Now in this diagram you can easily see what I want to show you with the live bone. That is we have the two surfaces, that is the lateral condyle of the femur, the medial condyle of the femur, the epicondyle of the femur, that is the medial epicondyle of the femur, the lateral epicondyle of the femur, the articular surface of the femur, and below we have the tibia, which have got a medial condyle of the tibia, the lateral condyle of the tibia, and between the medial condyle of the tibia and the medial condyle of the femur, they articulate forming the right or the medial femorotibial joint. Then we can see that this area, which is known as the patellar surface of the femur, is covered with the patella, and this forms the femoropatellar joint. And there is another joint which is formed between the fibula, head of the fibula, and the lateral condyle of the tibia. So, the fibula, this joint is not a weight-bearing joint. Fibula does not transmit the weight of the body from the femur. It is just give attachment to the muscles. So it is not a weight-bearing joint. जबकि patella के अंदर भी is a muscular attachment, that is the quadriceps tendon. And again, the majority of the weight bearing is the knee joint. All of the upper body's weight is transmitted to the tibia through the knee joint. And so, and then again you can see the tendon of the ligament capituli attaches to the tuberosity of the tibia. This is patella, medial condyle, lateral condyle, and then we have a group of ligaments. We move forward, and that is again the same thing. Okay. Distal femur, that is what are the structures which are present in the distal part of the femur. Distal part of the femur क्या हमारे पास lateral and the medial condyles है. और ये किससे आर्टिकुलेट करेगा, जनाब आर्टिकुलेट विद द मीडियल एंड lateral condyle of the tibia. और इनके दरमियान इंटरकोंडाइलर फोसा है, इनके दरमियान इंटरकोंडाइलर फोसा है, दोनों कोंडाइल के दरमियान. And we have a patellar surface present on the femur. So distal femur is one of the bone which take part in the articulation. Similarly, patella, again all we know is a sesamoid bone, and the main function of the patella is that it reduces the friction between the ligamentum patelli tendon and the bone. It provides a slippery surface. It provides an easy thing regarding the movement of this tendon. So it is basically a protective one. And within the tendon of the quadriceps, this sesamoid bone, which is known as patella, largest sesamoid bone of the body, is there. Proximal end of tibia, of course, when we talk about tibia, we have to look to the upper end of the tibia, and the upper end of the tibia is like this. This is the upper end of the tibia, or upper end of the tibia. The superior surface, it is the part which articulates with the condyles of the femur. So we have a lateral and a medial tibial condyle. So we have a lateral tibial condyle and we have a medial tibial condyle. A lateral tibial condyle or a medial tibial condyle, and they articulate with the respective femoral condyles. Then we have again an intercondylar area. Intercondylar area between this, जैसे intercondylar fossa femur में मौजूद है, यहाँ पे intercondylar area, और this intercondylar area gives eminence known as intercondylar eminence, which is known as intercondylar eminence. बीच में intercondylar eminence है. So intercondylar area, and then in the center we have an intercondylar. अगर आप देखें तो एक elevated area नजर आ रहा है. This is the intercondylar eminence. इस intercondylar eminence के आगे we have an anterior intercondylar area, और बिल्कुल इसके पीछे we have a posterior intercondylar area. तो हमारे पास एक anterior intercondylar area है और एक posterior intercondylar area, and these intercondylar area gives attachment, that is the anterior intercondylar area, and the posterior intercondylar area give attachment to the cruciate ligament, anterior cruciate and the posterior cruciate ligament. Similarly, they also give attachment to the anterior part of the medial meniscus and the anterior part of the lateral meniscus. The medial lateral menisci can be attachments within the intercondylar area. Then we have, of course, a tuberosity known as the tibial tuberosity. यहाँ पे tuberosity जिसको कहते हैं tibial tuberosity, which give attachment to the ligament of patella. This is again a diagram. अब आप ये इसको और अगर इसमें share कर लेते हैं, so this is actually what can be seen from the superior. जो आप देख रहे हैं ये superior aspect. So we are seeing this on the diagram. और इसमें आप ये देखें, this is the medial condyle of the tibia, and this is the lateral condyle of the tibia. This one gives attachment to the medial condyle of femur, and this one will going to give attachment to the lateral condyle of the femur. इसके दरमियान, दोनों के दरमियान जो एरिया है इसको कहते हैं intercondylar area. We call it as a intercondylar area. अच्छा, यहाँ पे intercondylar eminence मौजूद है, एक elevation होती है जगह पे. You can see from here there is an elevation, and this elevation के आगे जो एरिया होगा, so for example this is the elevation, इसके आगे ये जो एरिया है, this is the area known as anterior intercondylar area, and this is known as the posterior intercondylar area. ये tibial tuberosity, लिहाजा ये part होगा anterior intercondylar area और यहाँ पे posterior intercondylar area, और दोनों areas के अंदर gives origin to the anterior cruciate, anterior intercondylar area से anterior cruciate ligament की origin होता है, और posterior intercondylar area से posterior cruciate ligament की origin होती है, and then it gives attachment to the end of the anterior end of the medial meniscus, the anterior condylar area, the anterior end of the lateral meniscus, and the anterior intercondylar area. पीछे की जगह पे we have the posterior end of the medial meniscus and we have the posterior end of the lateral meniscus. So यहाँ पे अगर देखें कि anterior intercondylar area के अंदर जो cruciate ligament है, ये between the two menisci मौजूद है. Anterior cruciate ligament lie between the anterior end of the medial meniscus and the anterior end of the lateral meniscus. जबकि posteriorly the posterior cruciate ligament attaches most posteriorly, that is behind the posterior ends of the medial and the lateral menisci. So this is the feature of present in the surface of the tibia. So fibula, ये भी एक attachment देती है जो मैंने पहले discuss किया था between the head of the fibula and the lateral tibial condyle, but it is not involved in the weight bearing or the weight transmission, which is between the femur and the tibia. It just only gives attachment to the muscles. This is again another diagram. यहाँ पे आप देख सकते हैं how the knee joint is look like. That we have ligaments. This is the medial side, the medial condyle of the femur, medial condyle of the femur, medial condyle of the tibia, lateral condyle of the tibia, femur, lateral condyle of the tibia. इनके दरमियान intercondylar eminence मौजूद है, ligaments मौजूद है. Fibula, head of the fibula articulate with the lateral condyle of the tibia, and again this is a ligament of the patella. यहाँ पे patella attached होगा to the patella surface of the femur. The joint consists of the following ligaments and articulating surface. Now, what are the joint? What are the ligaments and what are the articulating structures present in the knee joint area? जनाब पहला हमारे पास आता है we have a capsular ligament. अच्छा, capsule तो कॉमन है, जितने भी synovial joints हैं they have got a capsule. अच्छा, कुछ capsules होते हैं, extra capsular ligaments होते हैं, कुछ intracapsular ligaments होते हैं. जितने भी आपको ligament नजर आते हैं ये बाल जगहों पे they are the thickening of the capsular ligament. The capsular ligament thicken to form ligaments, ठीक है. और कुछ ऐसे होते हैं जो कि कैप्सूल की लिगामेंट्स नहीं होते बल्कि वो बाहर से आते हैं, एक्स्ट्रा कैप्सुलर लिगामेंट्स होते हैं. So they are ligaments which are formed because of the thickening of the capsule and they form the capsular ligament. और initially अगर capsular ligament को आप कहते हैं वो ही capsule है. The capsule is the capsular ligament. That is, it wraps the whole of the joint. पूरे joint को the whole of the joint is wrapped by a capsule. आप एक towel मोड़ दें, towel से फिर लगा दें तो this towel acts as a capsule which has got a superior attachment and which has got an inferior. एक superior superior attachment of the capsule, inferior attachment. So we have capsular ligament. Then we have a tibial collateral ligament. Tibial collateral ligament is a ligament which is situated on the medial side. यानी कि medial collateral, दो collateral ligaments होंगे. We have a medial collateral ligament. अगर आप देखो तो जो कि medial condyle of the epicondyle of the femur को medial condyle of the tibia के साथ join होते हैं. This is known as the medial collateral ligament or tibial collateral ligament. और इसी तरह एक यहाँ पे lateral condyle of the femur को join कर रहा है with the capsule or the lateral condyle of the tibia, and this is known as the lateral collateral ligament और इसका दूसरा नाम होता है fibular collateral ligament. So medial or tibial collateral ligament and fibular or lateral collateral ligament. बात एक ही है. तो for easy description हम उनको नाम देते हैं tibial collateral ligament and fibular collateral ligament. Then we have an anterior cruciate ligament. Then we have the posterior cruciate ligament. Then we have the oblique popliteal ligament. We have arcuate popliteal ligament, and we have median and lateral menisci, which are the structure present in the knee joint. तो ये तकरीबन 7 ligaments हैं और एक दो आपके menisci हैं. This makes the ligament around the knee joint. Now capsule. सारी बात capsule की attachment होती है. हम हमेशा याद रखें capsule has got a proximal attachment that is it's attached superiorly with the femur. और फिर superior attachment के बाद it goes downward to cover to the femur tibia. So it has got inferior attachment. तो superior attachment कहाँ पे होगा जिसको proximal attachment कहते हैं वो femur पे attach होगा. So capsule is all around attached to the femur. अगर आप जब मार्क कर रहे होंगे femur को तो आप चौक से मार्क कर रहे होते हैं. आप intercondylar eminence के ऊपर से चौक ड्रॉ करते हैं फिर यूं लेके जाते हैं फिर patellar surface के ऊपर से ड्रॉ करते हैं. क्यों patellar surface के ऊपर ड्रॉ करते हैं? Because capsule is situated above the patellar surface. Similarly जब आप capsule को ड्रॉ करते हैं तो एक जगह capsule deficient होता है. The capsule is deficient in certain place. So capsule attaches superiorly to the femur and proximally to the tibia. Posteriorly, the fibrous capsule encloses the condyles and the intercondylar fossa. So posteriorly, capsule they are situated above the condyle. जहाँ मेरी उंगली है ना, capsule are going to attach over here. So it's going to encloses the condyle and the intercondylar eminence. अगर आप front पे देखें तो ये patellar surface के ऊपर से होता हो जाता है फिर it reflect over to the margins of the condyles. The fibrous layer has an opening posterior to the lateral tibial condyle to allow the tendon of the popliteus. मैंने पहले बताया जब आप कैप्सूल की मार्किंग कर रहे होते हैं तो this is the lateral condyle of the tibia. यहाँ पे एक गैप होता है. यहाँ पे capsule is not attached. There is an opening, and this opening is because a muscle is known as popliteus. This muscle pierces and attached to the popliteus. यहाँ पे fossa for popliteus. यहाँ पे popliteus fossa होता है. यहाँ पे popliteus के attachment होते हैं. तो उसकी वजह से there is a deficiency. So popliteus is an intracapsular muscle, and the tendon of the capsule it traverses the joint capsule. Inferiorly, the fibrous layer attaches to the margin of the superior articular surface of the tibial plateau, and that is inferiorly it is attached with the margins of the plateau. This is actually the plateau. The superior surface of the tibia is the plateau, and it gives attachment to the capsule like this. जितने में आपको लाइन नजर आ रही है यहाँ पे कैप्सूल अटैच होता है. मैं आपको उस डायग्राम दिखाऊंगा शायद आपको उसमें आप देखें ये आप देखेंगे येलो कलर की लाइनिंग नजर आ रही है. दिस इज द अटैचमेंट ऑफ द कैप्सूल. इंफीरियर अटैचमेंट ऊपर से आ रही है फीमर से. यहाँ पे आप ये देखेंगे इट इज अटैच्ड इन द एंटीरियर कॉन्डाइलर लाइन. पूरे मार्जिन पे अटैच हो रहा है टू द मीडियल लेटरल कंडाइल. उसके बाद रिफ्लेक्ट होगा. Then it goes into the intercondylar area से होते हुए इन cruciate muscle. Now जो anterior cruciate और posterior cruciate हम देखें anterior cruciate ligament they lie within the capsule. ये capsule के अंदर है. फिर यहाँ से reflect होगा. Then it goes like this. यहाँ पे there is posterior cruciate को भी cover करेगा. And then इस जगह पे यहाँ पे एक opening होगी. There is opening over here for the tendon of the popliteus. फिर again ये continue होगा capsule. And it joins with the first layer. So this is how it is attached to the plateau of the tibia. Achha, now the knee joint. The knee joint is also strengthened posteriorly by by two ligaments. दो ligaments होते हैं posteriorly, यहाँ दो ligaments होती हैं. एक तो main ligaments होते हैं, fibular collateral ligament, lateral collateral ligament, sorry, tibial collateral ligament, fibular collateral ligament, capsule. इसके अलावा एक oblique popliteal ligament है और एक है arcuate popliteal ligament. ये दो ligaments हैं which are present on the posterior aspect of the knee joint. और जो oblique popliteal ligament है, it is basically one of the tendons जो semi-membranosus है, when it attaches, it gives 5 slips. Semi-membranosus पर आप पढ़ें तो 5 slips होते हैं. उनमें से एक slip is attached to the knee joint, and this slip is known as oblique popliteal ligament, which is a slip of semi-membranosus muscle. बाद दफा BCQ में पूछते हैं कि oblique popliteal ligament is derived from capsule, from the fibular collateral ligament, from the tibial collateral ligament, from the menisci, or from the semi-membranosus. So it is basically derived from the semi-membranosus muscle. इसी तरह एक और है arcuate popliteal ligament. Arcuate popliteal ligament is again ये दोनों जो menisci हैं join कर जाते हैं posterior और capsule यहाँ पे thickened हो जाता है posteriorly and this forms the arcuate popliteal ligament. So derived from the tendon of biceps femoris. अगर आप देखें biceps femoris which is attached to the ये जो fibula है इस पे attached होता है bicep का tendon. तो bicep के tendon की extension है toward the posterior aspect laterally, and this is known as arcuate popliteal ligament. So oblique popliteal ligament and arcuate popliteal ligament. ये वो कैप्सूल के अटैचमेंट है जो आपको बताने की कोशिश कर रहा था मैं. You can see there are two things. ये जो ब्लू कलर का नजर आ रहा है आपको अनपार के साइड पे, this is actually the capsule. और ये जो रेड कलर का स्ट्रक्चर नजर आ रहा है, this is actually the synovial membrane which lines the capsule internally. तो आप ये देखें कि anterior cruciate ligament और posterior cruciate ligament ये दोनों कैप्सूल के अंदर हैं. So they are intracapsular. ये जरा याद करने की चीज है. The anterior cruciate ligament and posterior cruciate ligament both are intracapsular. यहाँ पे आप देखें, if you see on the lateral side there is a deficient. यहाँ पे कैप्सूल मौजूद नहीं है, and this is a gap for the popliteus tendon to come out because popliteus passes through this small gap and goes to the posterior. ये popliteus के लिए होता है. So this is how it is attached within the femur and the tibia. In fact, we are showing the plateau of the tibia. अब आते हैं medial collateral ligament और tibial collateral ligament. जाहिर बात है medial collateral ligament और tibial collateral ligament they are joining the medial condyle of the femur with the medial condyle of the tibia. ये दोनों medially join करते हैं by this collateral ligament, so that है tibial collateral ligament. इसके attachment होते हैं कि it is a strong flat intrinsic ligament, that is a capsular ligament. Thickening of the capsule extends from the medial epicondyle of the femur. Femur की medial epicondyle जो कि prominent part है condyle के अंदर, जो भी prominent part है उसको कहते हैं epicondyle. So it arises from the medial epicondyle of the femur, runs downward and is attached to the superior part of the medial surface of the tibia. Superior part of the medial surface of the tibia पे जाके attach होता है. कौन? Medial collateral ligament. So basically it is connecting the medial epicondyle of the femur with the medial surface of the medial condyle of the tibia and the upper part of the shaft. पे जाके attach होता है. Now what happens in the middle of this? ये जो medial collateral ligament है या tibial collateral ligament है, बीच में यहाँ से यहाँ तक extend कर रहा है, यहाँ से यहाँ तक बीच में it gets attached to the medial meniscus. So medial meniscus of the knee joint is attached with the medial collateral ligament. That is the tibial collateral ligament के साथ ये firmly attached होता है medial meniscus. उसकी वजह ये है कि एक movement है जब हम flex करते हैं, flexion करते हैं, तो due to the flexion the medial meniscus is brought forward in order to increase the surface contour area. एक mechanism है ताकि जो condyle के surfaces हैं वो directly bone पे attach ना हो. So we need a small movement of the menisci also जो menisci देखेंगे. So that's why the medial collateral ligament or tibial collateral ligament is attached with the medial meniscus of the tibia of the knee joint. Its midpoint, the deep fibers of the TCL, that is tibial collateral ligament, are firmly attached to the medial meniscus. Of course, यहाँ पर ये medial collateral ligament, from the medial epicondyle of the femur up to the upper medial part of the medial condyle tibia and the shaft of the tibia. Beach mein it is attached with the medial meniscus. Then we have the fibular collateral ligament, that is the lateral collateral ligament. तो वो जनाब यहाँ पे आएगा अगर आप lateral collateral ligament लिखते हैं तो this is the lateral collateral ligament. ये lateral collateral ligament है. अब कहाँ से? From the femoral condyle superiorly to the head of the fibula inferior. So ये attached होता है lateral epicondyle of the femur and then attached to the head of the fibula. ठीक है ना? It does not attach to the lateral meniscus. So it is not attached itself with the lateral meniscus. अब यहाँ पे question है, only the medial meniscus is attached with the medial collateral ligament. The lateral collateral ligament does not give attachment to the lateral meniscus and does not strengthen the fibrous capsule. It's a weak. So capsule is weak laterally क्योंकि ये बिल्कुल ही separate है जो कि epicondyle, lateral epicondyle को head के साथ join कर रहा है. So it is a bit different from that of the medial collateral ligament or इसको आप tibial collateral ligament कहते हैं. The tendon of the popliteus passes deep to the fibular collateral ligament separated from the lateral meniscus. अब इन दोनों meniscus के दरमियान, इन दोनों structure के दरमियान means between the fibular collateral ligament और meniscus के दरमियान जो oblique tendon of the popliteus है, it is there. आते हैं anterior, अब आते हैं cruciate के ligament. Cruciate is cross. So something which is cross is a cruciate ligament. So cruciate ligament is like a cross which is attaching the medial condyle of the femur and the lateral condyle of the femur with the plateau present on the anterior intercondylar area and the posterior intercondylar area. ठीक है? So इसके attachment के लिए हमें ये surfaces याद होनी चाहिए. यानी कि this is actually the medial condyle of the femur and this is the lateral condyle. इनके walls होती हैं. We have a lateral wall of the medial condyle, lateral wall of the medial condyle, and we have a lateral wall, medial wall of the lateral condyle. The lateral wall of the medial condyle ये होगा और medial wall of the lateral condyle ये होगा. So attachment is over the femur. अच्छा, origin इनकी कहाँ से होती है? That is from the plateau. That is the tibial plateau. यहाँ से इनकी origin होती है. The cruciate ligaments. So it arises from the anterior area. It's anterior condylar area आप कहते हैं. So it arises from the anterior medial aspect of the intercondylar area of the tibia and attached to the posterior medial aspect of the lateral femoral condyle. So ये यहाँ से arise होगा और femur की जो lateral condyle है, femur की lateral condyle हमारे पास जो है ना वो ये lateral condyle है. इसके medial wall पे जाके attach होगा. That is known as anterior cruciate. तो arise हुए anterior intercondylar area से attach होगा ऊपर जाके कहाँ पे? Medial wall of the lateral femoral condyle. और what is the function of this anterior cruciate? अच्छा, ये anterior cruciate ligament इस तरह है कि they prevent the slipping, यानी कि they prevent the anterior drawing of the ऐसा ना हो कि femur anterior dislocate करे और femur posterior dislocate करे. ठीक है ना? इनको cruciate ligaments prevent करते हैं. जो anterior cruciate ligament है, it prevents the excessive anterior motion of tibia. Excessive anterior motion of the tibia. Tibia के anterior यानी कि tibia को आगे move होने से रोकता है. Anterior. It prevents the anterior dislocation, anterior motion of the tibia, and the posterior motion of the femur. इन दोनों को prevent करती है. यानी कि बाद में अगर ये cruciate ligament ना हो, तो the tibia will move anteriorly. इसको prevent करता है. अगर मैं tibia को anterior move करूं, there will be a tightening of the anterior cruciate ligament. और अगर मैं femur को posterior लेके जाऊं, there will be tightening of the anterior cruciate ligament. तो ये cruciate ligament के जरा एक्शन को इस तरह याद करना. Then we have the posterior cruciate ligament. अच्छा, posterior cruciate ligament कहाँ से rise होगा? Again posterior intercondylar area से, and it will go upward. अब ये attach होगा on the medial surface, on the lateral surface of the medial condyle. Medial condyle की जो lateral surface है उस पे जाके attach होगा. ये opposite होता है. Like this. देखिए anterior cruciate है, ये lateral condyle के medial wall पे attach हो रहा है और ये posterior cruciate ligament है जो posterior intercondylar area से arise कर रही है and it is attached to the lateral surface of the medial condyle. अच्छा, अब क्या है कि बिल्कुल इसका रिवर्स है. It resists posterior movement of tibia. It resists the posterior movement, that is prevent the posterior movement of tibia and the anterior movement of the femur and the anterior movement of the femur. ये दोनों एक दूसरे के रेसिप्रोकल उलट है, opposite है. The anterior cruciate and the posterior cruciate ligament. Main function is strengthen the capsule, strengthen the anterior aspect of the knee joint. अच्छा, अब इसका काम बेसिकली अगर आप काम देखें, इनका काम है कि fibrous capsule on the whole prevent the anterior and posterior dislocation of the tibia and the femur, and they are basically the one which internally, because they are intracapsular, so they internally tightly adherent to the bony surfaces of the tibia and fibula. So the two ligaments, that is the anterior and posterior sheaths, are very important ligament in the sense कि जो flexion और extension है, इस दौरान कहीं ना फीमर स्लिप करे आगे और ना टिबिया आगे स्लिप करे. इसी तरह ना फीमर पोस्टीरियर स्लिप करे ना टिबिया पोस्टीरियर स्लिप करे. इनको प्रिवेंट करते कौन? ये क्रूशिएट लिगामेंट है. इसके अलावा हमारे पास और भी स्ट्रक्चर्स हैं which, जैसे हमने कहा था, posterior aspect of this joint is strengthened by posterior aspect of this joint is strengthened by two ligaments, oblique popliteal ligament and arcuate ligament. Oblique popliteal ligament is a slip from the semimembranosus, and arcuate popliteal ligament is arises from the biceps. Similarly, anteriorly क्या होता है कि it is being again reinforced by the tendon of the ligamentum patellae or quadriceps tendon, ठीक है, through the patellar tendon. और इसके अलावा जो patellar retinaculars हैं, अगर आप vastus medialis, vastus lateralis, vastus intermedius, ये सारे अटैच होता है, इस तरह rectus femoris they are attached to the patella. उसके पास इनकी कुछ एक्सटेंशंस होती हैं, यानी कि वास्टस medialis एक्सटेंशन देती है और वास्टस lateralis एक्सटेंशन देती है, जिनको हम retinaculars कहते हैं. And these retinaculars in fact reinforce the joint from the anterior. Reinforce करते हैं joint को interiorly. So they are the extension of the fascia from the quadriceps. जो vastus medialis और lateralis ये quadriceps के part हैं, इनके the fascia they are called the deep fascia. Deep fascia form a retinaculum like this. So they strengthen the joint from the anterior. फिर आते हैं menisci. Now menisci are fibrocartilage. ये menisci क्या होते हैं? Fibrocartilage होते हैं. Main function menisci क्या होता है? अब आप देखें normally जिस तरह glenoid cavity is not deep. It is somewhat not a very shallow one. लेकिन एक चीज है जिसकी वजह से उसको क्या कहते हैं, what we call that fibrocartilage which deepens the glenoid cavity, glenoid labrum, ठीक है ना. glenoid labrum causes the deepening of the glenoid cavity. इसी तरह the condyles of the femur are straighter one, बहुत आसानी से can slip, but in order to make it deepen there are fibrocartilage. Fibrocartilage plates होते हैं C-shaped. They are C-shaped fibrocartilage which are attached to the plateau or the superior surface of the tibia, upper surface of the tibia, and they are known as the menisci. इनको menisci कहते हैं. दो होते हैं. एक we have a medial meniscus and we have a lateral meniscus. इनका काम क्या होता है कि they act as a shock absorber. Number one. Number two, they prevent the slipping of the condyles of femur. और दूसरी बात है कि ये जॉइंट कैविटी के अंदर एक गैप को कम करती हैं और कुशनिंग इफेक्ट देती हैं, ताकि whenever we are running, we are jumping, so we can't feel any pain and the condyles they are not easily slipped out because of the concavity formed by the menisci. So we have two on each side of the tibia loosely attached to the outer side. Their function is stabilization, shock absorption, and of course the lubrication. These are the function of the menisci. The menisci are cartilaginous plate fibrocartilage, and they are present between the joint. But agar baad like certain sport like basketball, like fast baller, when you jump बहुत तेजी से करते हो, these menisci they come under pressure and when we jump like this, so weight of the, I mean ये तो मैं बहुत देखा हूँ, ऐसा नहीं होता, लेकिन the femur they move and they act as a shock absorber. अगर बहुत ज़्यादा पावर हो या बहुत ऊपर से आपने जंप किया हो, they are बहुत फास्ट बॉलर्स होते हैं, they usually put their right or left leg in the ground to bowl they may rupture this cartilage. तो वो meniscal tear कहते हैं. We call them as a meniscal tear. And this menisci get teared, और अगर tear हो जाए because they are cartilage, इनकी blood supply नहीं होती cartilage. So the tear may result in the damage, which may be a permanent damage to the menisci, and you have to remove them. इसको फिर इसको menisci को remove करके prosthesis डाल देते हैं आजकल, तो वो काम कर लेता है menisci का. Their properties composed of fibrocartilage, cover the superior surface of the tibial condyles, adapt the shape of the tibial condyle to provide a better fit between tibial and the femoral condyles. Then transverse ligament of the knee, continuation of the anterior fibers of the lateral meniscus to the medial meniscus. ये एक extension है transverse ligament of the knee. हम कहते हैं ये menisci के दरमियान extensions होती हैं. तो यहाँ इसकी कोई importance नहीं है. We sometimes call it as a transverse ligament of the knee. It is a continuation of the fibers of the menisci which are attaching anterior with each other. Then we have the coronary ligaments. एक और extension है fibrous capsule का, जो कि menisci को tibial condyle से attach करता है. coronary ligament. एक oblique जो हम discuss कर चुके हैं. तो ये जो नाम है ना, coronary, oblique, arcuate, these are the extra ligaments which are the modification of the capsule itself. Asal ligaments are the tibial, the fibular, the cruciates. ये important ligaments. अब muscles which are attached, of course, anteriorly we have the quadriceps. हमारे पास तो anterior quadriceps मौजूद है. Vastus medialis, lateralis, medialis, rectus femoris. Posteriorly we have these muscles: biceps femoris, semimembranosus, semitendinosus. ये छोटे ना sartorius, gracilis, popliteus. ये वो smaller muscles हैं which are attached on the medial surface of the upper end of tibia. So basically इनका काम क्या होता है, जो posterior part of the hamstring group है, basically they call it flexion of the knee joint. So flexus जो primarily वो biceps हैं, semimembranosus, semitendinosus, supported by sartorius, gracilis, popliteus and gastrocnemius. Popliteus का role एक अलग है, वो देखेंगे यार. So what are the functions which knee joint उसका extension है, which are done by the quadriceps. We have the flexion, which are done by the hamstring, semimembranosus, tendinosus, long end of biceps, short end of biceps. So ये करते हैं flexion. Then we have medial rotation, semitendinosus and semimembranosus, and knee is flexed. And popliteus when non-bearing. ये जो movement है ना, ये locking and unlocking में आपको समझ में आएगा. And of course the lateral rotation. अच्छा, अब जनाब एक important part है. Knee joint काफी बड़ा joint है. मैं तो उसको कंप्लीट कर रहा हूँ 45 मिनट्स में, लेकिन हो सकता है जेनिकुलर एनास्टोमोसिस आपको खुद से करना पड़े, बिकॉज ये इंपॉर्टेंट है ज्यादा. इसमें क्या होता है कि देयर इज अ लॉकिंग एंड अनलॉकिंग मैकेनिज्म ऑफ द नी, एंड दिस इज वेरी इंपॉर्टेंट कि लॉकिंग ऑफ द नी जॉइंट एंड अनलॉकिंग ऑफ द नी जॉइंट. लॉकिंग अनलॉकिंग से मजा क्यों समझ लें, अब तस्वर करें कि दिस इज एक्चुअली अ जॉइंट, और जब हम फुल एक्सटेंशन पे आते हैं, वो फुल एक्सटेंशन, तो हमारे पास फुल एक्सटेंशन के लिए मीडियल कंडाइल जो फीमर के मीडियल कंडाइल इसमें जगह नहीं होती. इन ऑर्डर टू गिव अ प्लेस ऑफ द मीडियल कंडाइल ऑफ द टिबिया टू कम इन कांटेक्ट. सो व्हाट हैपेंस कि ड्यूरिंग फुल एक्सटेंशन, इसको आप कहते हैं फुल एक्सटेंशन, क्या होता है कि जो टिबिया है दैट स्लाइटली मीडियली रोटेट, जिसकी वजह से जगह हो जाता है एंड इट इज लॉक्ड. समझ लीजिए फुल, अब ये फुल फ्लेक्शन नहीं हुआ है नाउ, बिकॉज देयर इज नो स्पेस फॉर द condyles, that is the femoral condyles to move, so it will slightly rotate medially, and it will get a place and it will be locked. ये locked है, ये lock हो गया knee, full extension is locked, knee locked, ठीक है. All the ligaments are taut. Now what happens when we unlock a flexion, जब हम unlock होते हैं, so what happens, there is slight lateral rotation of the tibia and it gets unlocked. ये जो lateral rotation of the tibia slightly, it is done by the popliteus. So that's why popliteus is known as unlock muscle. It unlocks the knee joint. Unlock the knee joint, so it can further flexion. So there is a full flexion, extension, इसको lock knee कहते हैं. और जब ये laterally rotate करेगा tibia, because of the contraction of popliteus, it become unlocked and it will go into flexion. इसको आप YouTube में देख लीजिएगा, बहुत अच्छी तरह से explain किया locking and unlocking. टाइम नहीं लिया मैं faster. There are bursas around the knee joint, at least 12 bursas हैं, which are suprapatellar bursa, gastrocnemic bursa, prepatellar bursa, subcutaneous bursa. Bursas क्या होते हैं? They are fluid-filled sacs of synovial membrane which are present between muscle tendon and the bone to reduce the friction, and they are about 12 bursas all around the knee. ये एंटीरियर ड्रॉट टेस्ट है और पोस्टीरियर ड्रॉट टेस्ट है, इसको आप देख लीजिएगा कि एंटीरियर ड्रॉट टेस्ट को हम कब इंटीग्रिटी ऑफ द एंटीरियर क्रूशिएट लिगामेंट चेक करने के लिए वी हैव एंटीरियर ड्रॉट टेस्ट. इसमें अगर एंटीरियर क्रूशिएट लिगामेंट रप्चर हो जाए तो व्हाट विल हैपन, अगर हम एंटीरियरली खींचें इसको फीमर को, इट विल मूव एंटीरियरली. सो दिस मींस दैट देयर इज अ डैमेज टू द एंटीरियर क्रूशिएट लिगामेंट. और पोस्टीरियर ड्रॉट टेस्ट में क्या होगा कि अगर हम फीमर को पोस्टीरियरली ड्रॉ करें तो दैट विल मूव पोस्टीरियर, तो कहता है पोस्टीरियर ड्रॉ टेस्ट. ये डिफरेंशिएट करता है बिटवीन एंटीरियर और पोस्टीरियर क्रूशिएट लिगामेंट. द पीसीएल इज शॉर्टर एंड स्ट्रॉन्गर देन द, so posterior cruciate ligament is shorter and stronger than the anterior cruciate ligament. तो ज्यादातर रप्चर होता है ACL, anterior cruciate ligament, लेकिन PCL काफी टफ है, स्ट्रॉन्ग होता है. Then there is arterial supply around the knee joint और arterial supply को हम कहते हैं genicular supply. 5 genicular branches होती हैं, superior medial and lateral genicular arteries, inferior medial genicular arteries और medial genicular arteries. ये genicular arteries basically are the branches from, because it is an anastomosis, so it has a different arterial sources like coming from popliteal, tibial, anterior tibial, posterior tibial, femoral. ये सारे arterial network जो join together to form the genicular anastomosis. वो इस तरह से anastomosis बनती है कि यहाँ पे देखिए superior medial genicular है या lateral superior genicular है, inferior medial genicular है, यहाँ पे inferior lateral genicular है, ये और एक middle genicular है. ये सारे genicular tibial से femoral से lateral circumflex के साथ ज्वाइन करते हैं and they form an anastomotic network around the knee joint. का फायदा ये होता है कि during flexion there is a compromise of the blood flow, and these anastomoses they provide an extra sources of blood. So that's why these are very important blood supply to the knee joint area, and they provide adequate blood supply of leg during the flexion, because popliteal fossa kink हो सकती है because it is present in the popliteal fossa. Anastomosis इस तरह बनती है और ये एक डायग्राम है दिखा तो ये anastomosis है. सुपीरियर मीडियल जेनिकुलर anastomosis कर रहा है इंफीरियर जेनिकुलर के साथ. इसी तरह यहाँ ये anastomotic एरिया, सुपीरियर जेनिकुलर, इंफीरियर